Greetings to one and all. Every year on December 1st, the world commemorates World AIDS Day to show support for people living with and affected by HIV and to remember those who lost their lives to AIDS. Acquired immunodeficiency syndrome or AIDS is the most advanced stage of HIV infection. Human immunodeficiency virus or HIV targets the immune system and weakens people's defense against many infections, gradually making them immunodeficient. Today, on the occasion of World AIDS Day, we have with us Dr. Ashok Kumar, who is former Deputy Director General of the then Department of AIDS Control. He retired as Additional Director General of Central Health Services from Ministry of Health and Family Welfare, Government of India. Dr. Kumar is currently the member International Commission on Certification of Dracunculiasis Eradication at World Health Organization. He is also the chairman of Bureau of Health Informatics at Bureau of Indian Standards. And he's also served as chairman of EMCTC committee and various other technical committees. Today, we are going to interact with Dr. Ashok Kumar. So, sir, to start with, is AIDS communicable?
Yeah, well, thank you, Miss Priya, for this interaction. And at the outset, on the occasion of this World AIDS Day 2022, I congratulate National AIDS Control Organization, the Ministry of Health and Family Welfare, Government of India, all the partners, the stakeholders, especially our wonderful people living with HIV and AIDS in our country. Well, as you asked, yes, HIV infection and AIDS are definitely communicable if the prescribed preventive measures are not adhered to. Nevertheless, our country dedicated efforts over last more than 4 decades have very successfully brought down the HIV AIDS burden to nearly 90%. And this is a matter of joy. Yeah.
That's a huge achievement, sir.
Yeah.
So where can one get tested for HIV?
Well, that's a very important issue for the people to know, and they all also are aware that our National AIDS Control Program, along with all the state AIDS control societies, have created well-functional and accessible network of HIV counseling and testing centers throughout our vast nation. And this is all free and confidential services. Every health facility in our country helps the suspects in this direction.
Wow, sir. So how can we prevent the transmission of HIV?
Uh, well, very important and crucial thing is ensuring the safe and protected sex, avoiding multiple sex partners of unknown HIV status. This is really very important to prevent HIV transmission. Further, that drug use is also quite common in our country. So the intravenous drug users should never share the same syringes and needles. In any case, anyone who has ignored these prescribed preventive practices, then he or she should promptly consult the doctor. And HIV-free counseling, testing, and treatment services for the early diagnosis and further guidance.
So what is your view on HIV care?
This is something very important, and our country has very successfully been implementing the care for health of all HIV and AIDS affected people. For anyone who is found HIV positive and or suffering from AIDS, the government of India has provisioned for free, confidential, quality ensured full treatment. And there is a regular follow-up through efficiently functioning ART centers as well as all the hospitals and major health facilities in our country. We all and the families of all such people living with HIV should heartily support and encourage all the people living with HIV with equity and no fear, and they're also human.
Rightly said, sir. There should be no discrimination
Yes.
since it's a disease and it can be treated with care and full support of family and friends.
Yeah.
So can we prevent or eliminate the mother to child transmission of HIV and AIDS? And if yes, then how is that possible?
Well, this is a very important issue. We have to eliminate HIV and AIDS in a little much more tough way. But we can definitely prevent the vertical transmission of HIV and STI from the infected mothers to the newborn in a very successful manner. Now, for this purpose, though it is a challenging task, that annually we need to screen nearly 28 to 29 million pregnant women. And our country has very successfully progressed in this direction. This is possible because besides our regular HIV/AIDS facilities, all the primary health centers in our country, as well as all their sub-centers in our country, with the committed support of our peripheral healthcare functionaries, we have the provision of HIV and STI screening of all pregnant women. And this is going very successfully. So we can do that. And once we detect a positive pregnant woman, then immediately there is a system of giving the treatment and also the prophylaxis for the newborn. Our country surely aims that in the seeable near future, no child be born with HIV and STI. And we are very successfully moving in this direction.
So, the people with HIV should take this into consideration and definitely get them tested and look into vertical transmission of HIV. So, there is a lot of stigma around AIDS and people living with HIV. So, how can we destigmatize AIDS and bring equity to end HIV? And also, how near are we in achieving equity to end HIV?
Well, Priya, you are aware that, with our continued political commitment and the successful national AIDS control program, with all our partners, stakeholders, and the community even, our country has tremendously reduced the stigma towards the people living with HIV and the disease, because we have demonstrated the successful early treatment, and the country has already brought down the HIV/AIDS situation to more than 90% over last 4 or 5 decades. So, in my opinion, the stigma is not that much as it used to be few decades back. And naturally, our Bharat now is moving with the dedication towards goal of ending AIDS as a global health threat by 2030. We are moving. And public, only thing is, wherever people still are having a fear, your mass media, your educational, our health approaches, they're all available for people to remove their misconceptions, if at all any, and use our existing health facility.
So, proper Sorry, please go on.
Yeah,
Sir.
even just now I was the co-chair of one of the projects was done by our country by Path, that we are even still moving on HIV self-testing methodology. So once our country ministry drug controller it approves these test kits, they will also be available in the market for their use appropriately by the people at high risk. So this is another big progress is going to one.
That's a huge progressive
Yeah.
thing for HIV and for people living with HIV and AIDS. So, a small message that you would want to share on World AIDS Day 2022.
Yeah, this World AIDS Day 2022, it very strongly urges each one of us to pledge and address the inequalities that are really holding back the progress in ending HIV/AIDS from our globe. So I'm sure each one of us will join our hands together to continue to accept all our people living with HIV, give them as care and affection, and also protect their employments, push them into the full social life so that they remain as a very proud people of our country and nation. And we'll be really grateful that we succeed, everyone succeeds in that
Very rightly said, sir. Thank you so much, sir. This was a really informative session. And very rightly said, as you said, that together we can address the inequalities which hold back the progress in ending AIDS. Thank you so much, sir.
Yeah, well, thank you. My privilege and proud to be the part of this discussion and through you to everyone in our country. And we are here to serve people and serve the humanity. Thank you.